Jesus Fernando is a 24-year-old Latin American male that recently took a 2-week vacation from his job at Eastern Aquinas Elementary School to go to New Orleans for Mardi Gras. Unlike his family, Jesus is pretty healthy. He eats well and exercises at least 3 times a week, and his only major health issues was when he was 12 years old and fell off his bike going down a big hill, breaking both his right wrist and left ankle. Whilst in Louisiana, he decided to take a break from partying and take a tour of the swamps where the mosquito population is very high. When he got back from the tour, he was covered in mosquito bites. However, this did not stop him from going out some more. During the last few days of his trip, he began to have diarrhea, nausea, dizziness, fever, and chills. However, he thought he had just gotten the flu, so he went to the ER because he felt he was getting dehydrated. The turning point came when he was in the ER and began to have convulsions and went into a coma.
The first biomedical professional that Jesus came into contact with was an ER nurse and a physician. A physician would order the treatments and tests on Jesus when he came into the ER, and an ER nurse would make sure that Jesus was getting the correct treatment that he had been ordered and make sure that he was feeling comfortable. The ER nurse gave Jesus an IV because he was losing fluid from barfing and diarrhea. When Jesus began convulsing, the nurse would be the first ones to attend to him, followed by the doctors. After Jesus went into coma, he was moved to the ICU, where he was met by another type of nurse, an ICU nurse. An ICU nurse is similar to an ER nurse in that both must be able to assess situations quickly. However, an ICU nurse must constantly monitor the vital signs of their patients and be ready to go into action whenever needed. An ICU nurse would check on Jesus' condition every so often and make sure that he was still alive.
While in the ICU, Jesus had his blood drawn by the nurse. This is done by inserting an IV needle into the patient's veins so that the blood could be taken out. Along with the blood test, Jesus had a lumbar puncture or spinal tap done on him by the physician. A spinal tap is where a patient either sits with his spine vertical and leans forward or lays on their side and arches their back. Then a needle is inserted between the vertebrae and the lumbar region of the spine, and a sample of cerebrospinal fluid is taken. The physician sent the samples to the lab in order to test.
The sample of blood and cerebrospinal fluid was sent to the lab where it was tested by a lab technician. The lab technician used equipment to help locate different microorganisms in the blood and cerebrospinal fluid. The results were sent back to the physician as readable data to help him diagnose Jesus. The test showed that there were indeed high levels of certain antibodies, which led the medical professionals to believe that Jesus had some sort of viral infection because antibodies are used to fight viruses. The results showed that there were very high levels of immunoglobulin G. High levels of this cerebrospinal fluid indicate that the body is currently fighting a viral or bacterial infection. However, they were unable to identify this virus.
After a day of being in a coma, Jesus woke up and still felt bad, but he was awake. He woke up complaining about an excruciating headache, so the ICU nurse gave him some Percocet. Once Jesus had woken up, the doctors ordered that he have an MRI and a CT scan done. A CT scan and an MRI both begin in the same way, the patient lying on their back and being slid into a machine. However, in a CT scan, the machine looks like a large donut and an MRI machine looks like a large cylinder. During a CT scan, the body has multiple X-rays taken of it and creates a cross-section of the brain. During an MRI, the machine uses magnets and radio waves to take a detailed image of the body and create many different cross-sections of the body. The scans showed his brain swollen and inflamed. The doctors diagnosed him with encephalitis.
Once determined that Jesus has encephalitis, he is given an electroencephalogram or an EEG to see if he is still having any sort of seizures. EEGs are when a patient has electrodes attached to their scalp which monitor their brain's activity. The results of the test came back and showed that Jesus had been having small seizures the whole time. However, they were so small that they could not be seen as they were happening.
The doctors were able to identify that Jesus had gotten Eastern Equine Encephalitis virus, or EEE or EEEV, from one of the mosquitoes in the swamp. EEE is in a class known as arboviruses and causes inflammation of the brain or encephalitis. It was first discovered within horses in Massachusetts in 1831, with the first confirmed human case in 1938. On average, there are 7 cases of EEE annually in the United States. However, a third of those may die, and the patients who recover may have lasting neurological issues.
There are no known cures or vaccines for EEE. However, Jesus was most likely given acyclovir as soon as it was found out that he had a viral infection because that drug is a strong antiviral drug. However, it may not even have been effective for EEE. There were only two options for treatment: not doing anything and letting Jesus try to fight it by himself, or give Jesus painkillers, a respirator for breathing issues, sedatives for restlessness, and anticonvulsants for seizures, and corticosteroids for brain swelling to make fighting it easier. The doctors decided to give Jesus the regimen of medications because it made him feel better while he's trying to fight off the disease.
The medical interventions that were done with this patient were an IV, Percocet, and acyclovir. An IV was given to Jesus when he first arrived to the ER. He was losing fluids, and the IV would help maintain his fluid balance. He was given Percocet for his headache when he woke up from his coma. He was given acyclovir when the doctors figured out that he had EEE. The acyclovir helps get rid of viruses.